So now, yesterday you have learned about in this workshop of synopsis writing. Yesterday's class you have learned about how to frame a research question, what you are supposed to write in aims and objectives, and how to do the literature search. Yes. So now in today's session we are going to start with materials and methods. So in materials and methods, what points you are supposed to include when you're writing your synopsis. The whole idea of this particular workshop is to guide you how to write the synopsis so that you will have less comebacks from the scientific as well as the ethics committee. Okay, so what all things you have to include is, first is you have to write which type of study you are going to do. So the type of study can be broadly categorized into observational study and interventional study. Now, depending on whether you are going to include the comparison group, it will be descriptive or analytical study. The details of the study design is going to be covered in the next session. Okay, so you have to write the proper scientific terminologies of the type of study design. Next is so type of study and study design you will mention, as it will be taught to you in detail by the Dr. Hetal in the next lecture. The next you are going to write is the place of study, where exactly you are going to do your study. So all of you, most of you will be writing your department along with any, if it is a collaborative study with say medicine with pathology or pathology with radiology and some other clinical branch, then you have to write all those departments. And Dr. D.Y. Patil Medical College Hospital and Research Center, Dr. D.Y. Patil Vidyapeeth, Pimpri, Pune. So the whole thing should be written properly. The period of study for your batch will be July 2022. So say by June end, 30th June is your last date of submission of synopsis. Before that, you are supposed to present your synopsis in front of all the professors and associate professors of your department, who will act as a subject expert for you. And they will tell you any corrections are required in your study project. Okay, and once you have presented there and everybody has okayed your project, then you are supposed to write a letter draft to the scientific committee that it was presented in the department in presence of all the professors. And so that format has been already circulated. So you are supposed to take signature of your HOD, and that letter should be attached to your synopsis. This is very, very important, because for scientific clearance, it has to pass through your departmental experts of that particular subject. Okay, so you have to attach that letter. Then comes the sample size calculation. So how to do so you are going to write what sample size you have calculated, and you are also supposed to mention how did you arrive at the sample size. Now, how to calculate sample size will be covered in detail by Dr. Jadhav, and he will be teaching you how to calculate the sample size. You also have to mention that ethical clearance will be taken before the start of the study, and written informed consent will be obtained from all the patients. These two sentences are must, and not only the sentences, the informed consent form also you are supposed to attach. In pediatric patients, you have to attach the SN forms also. Okay. So these are the study designs. You have to decide which type of study you are going to perform, whether it is so most of the pathology studies will be descriptive, observational, cross-sectional studies. Okay. And depending on the clinical branch, which one what particular is your study, depending on, you have to write the type of study. And it will also depend on the relation between the exposure and outcome that will be taken for you in detail in the next session. Now, you have a large population. So study population is huge, and you have to do the sampling from that particular population to arrive and get the representative population for your particular study. So this has to be done in three aspects. It should be defined in time, place, and person. Okay, so where, what time duration you are going to take, whether it is going to be um, rural setting or urban setting or hospital based study, so that also you are supposed to mention, and the person, so which age group you are going to select, which particular sex is included, whether both the males and females, or that you have to mention. Now there are different methods, sampling methods. Now here I would like to mention that all of you are supposed to join online course of basic research methodology, and that is compulsory for all the residents. So once you do that, you join that course online, you have to finish it, and you have to give the exam. So I think every 6 months it is available. So all of you please register for that cycle. If this cycle 6, I believe, has started, so those who have not registered can register, still register, or register for the next session. So there you will have online lectures and exercises, small assignments will be given. You have to clear that, and after that you have one in-person exam, online exam, but you have to go at the center and give that particular exam. So this is very, very good, not only for your thesis, but in the future also, if you are planning to conduct any research, this particular course will help you a lot. Okay, so we are not going into the detail of what are different sampling methods, etc., etc. Everything will be taught to you, and it is supposed that you are supposed to attend and learn from that particular thing. So just to enumerate what are different methods, these are simple random sampling, systematic sampling, meaning every fourth or fifth case you are going to select, stratified sampling, cluster sampling, meaning from one different groups you are going to select few people. Okay, and multi-stage sampling, like at different levels, like in mostly in the PSM, from from PHCs from some rural area, then some from the urban areas, like that. So all these are different sampling methods, the details of which you are going to learn by self-directed learning process by attending that basic research methodology course. Now moving on to further study population inclusion criteria and exclusion criteria. These are very important. After sample size and ethical clearance you have taken, how you have decided your study population, you have to write in detail what are your inclusion criteria and what are your exclusion criteria. If it is a clinical based study, and if you are going to do some randomized clinical trial, I mean, which is generally not done as a thesis, but if in future you are going to do some project, you have to decide how you are going to do the randomization. So that method also you are supposed to mention when you are writing your synopsis. So moving on to inclusion criteria, you will have to decide the sample main characteristic of the target population should be selected that pertain to your research question. So this has to be decided based on clinical, geographic, demographic, and temporal characteristics. So here it is shown that you have to ensure that your findings are representative of the population of interest. Okay, so whatever data you're going to collect should represent the entire population. So this selection should be at affordable cost. Now again, if I give you example of pathology and you are going to do a study on immunohistochemical markers, like you may not be able to, and if you have to spend for the marker, it is not possible to do that particular marker on all the samples. So you have to select on which selected cases you are going to perform IHC or things like that. Okay, so that should be covered in your selection criteria. The adequate size should be decided to control the random error of selection. And from the entire population, you have to define the clinical and demographic points which will help you to arrive at a target population. From the target population, based on the geographical and temporal factors, you will have to find out the accessible population, and from that accessible population you are going to derive your study sample. So so that was about the inclusion criteria. I will give you in the next slide the example how you are going to select the patient. So let us do it right now itself. So for example, if your title is clinical trial of low dose metformin to reduce dysmenorrhea in females of polycystic ovarian disease. So here, based on demographic characteristic, your inclusion criteria, you will have to write that you are going to select all the females in reproductive age group, and you have to specify the age. Like any other synopsis topic or any other research question, you have to mention which age group individuals you are going to include in your study. Based on clinical characteristics, you have to write in your inclusion criteria that you are going to select females with polycystic ovary and with dysmenorrhea, because you are going to study dysmenorrhea, you're going to treat dysmenorrhea with metformin. So you, out of polycystic ovarian disease, those who have dysmenorrhea will be selected in your in your study population. So that becomes the clinical characteristics of your inclusion criteria of your study population. Based on geographic characteristics, all the patient of POCD with dysmenorrhea anywhere in the city of Pune, you are not going to include in your study. So whom will you include? You have access to the people or patients who are attending the OPD of hospital of say DY Patil Vidyapit Pimpri Pune. So that also you have to include in your inclusion criteria. And temporal is the time span. That is, there are so many patients, but we are not going to do retrospective, we are going to do prospective. So you have to give the time span, or if you are going to study retrospective also, you have to give the time span that from this duration to this duration, whoever is present will be included in your study design. Okay, so that was about your inclusion criteria. Now moving on to exclusion criteria. Whom will you exclude from your study? Whom will you not include in your study? So you have, these are the subsets of individual who interfere in the follow-up of efforts, then in the quality of data, those acceptability of the randomized treatment, and those interfering with the clinical concerns. So those individuals who are going to alter your study results should be included. Like I will give you an example of pathology, since I'm a pathologist, that if you say, if there is a study of say macrocytes in megaloblastic anemia, the causes of macrocyte other than megaloblastic anemia should be excluded. Okay, so you see macrocytes even in liver disease or kidney disease, like that. So if you want the cases of megaloblastic anemia only, you are going to exclude these things because they also will show macrocytosis. Okay, so such cases should be excluded. So you must know what you're going to exclude, and at the same time you should be aware of why you are going to exclude these cases. There has to be a definite reason behind it to exclude these things from your study design. So coming back to the same example of clinical trial of low dose metformin to reduce dysmenorrhea in females with PCOD. Exclusion criteria with interference with loss of follow-up. So those who have chances of relocation, or they are getting relocated after marriage, or whatever may be the reason. So those patients should not be included. Jiska follow-up nahi mil raha hai, usko you do not include. Interference with the quality of data, that is patients already on metformin therapy for some other cause like diabetes. So diabetic individuals who are on metformin should not be included in your study, and it should be included in your exclusion criteria. And being at high risk of possible adverse effects, like those who have hypersensitivity to metformin, or those who are suffering from renal dysfunction, should not be included in your study. Okay, so these are your exclusion criteria. So you have to define your study population properly in terms of inclusion and exclusion criteria. And I've already taught you how to decide your inclusion and exclusion criteria. Now, after this, moving on to the methodology proper. So you have to mention how you're going to do the data collection, and whatever you are going to perform some procedure and obtain the results. So like, so each procedure should be mentioned in detail, which machine you are going to use, or which surgical operative procedure you are going to include in your thesis. So everything, whatever you are going to do, should be written in a chronological order. Say first, again, I will give you example of pathology. First, you're going to collect the blood. Okay, if you're going to do certain tests, so how you are going to what, so you have to mention how you are going to take the informed consent of the patient. Then you are going to collect the blood, so you have to write the procedure of blood collection. Then if you are going to do some particular test, you have to write the methodology of that particular test. If you're going to run the sample on some instrument or some biochemical analyzer, you have to write the name, which analyzer you are going to use, what is the principle of the analyzer, or whatever method you are going to use. So everything should be written in detail. And again, I'm telling you, all these things should be checked. You have to present it in front of your department people, so that they will be the best person to suggest you the modification, because they are subject experts. Yes, so you have to write the procedure in detail, how you are going to do the data collection. So a proper pro forma should be prepared, and that should be attached to your synopsis. So that will include the case number, the age, sex, and all other demographic profile, and whatever you are going to collect, like depending on your research question, what are information you are going to collect from your this thing. Now this pro forma should be in detail, and an Excel sheet should be prepared in your laptop. And as and when you are getting your case, you have to start entering your data in that Excel sheet. Yes, so all these things are very, very important. And then the methods of the tables, what tables you are going to prepare, like how you are going to analyze the data, at least some idea, more idea you will get it once you finish your results and you analyze it. But what tables you are going to prepare, all those things also, when you're doing your review of literature, how other studies have analyzed their data, should be kept in mind. And you should have something in your mind how you're going to analyze your data, how to put it, like whether you're going to produce represent it in a histogram or bar charts or whatever. Now methods of data analysis, which statistical analysis you are going to use, that is also very, very important, and it should be decided before you start your study, because otherwise it may create some problem later on. So how to analyze your data is going to be taught to you in the subsequent sessions in detail. So I'm not going to touch upon those parts. So more or less you are going to, you should have a step-by-step points, how you are going to go about working on your project, well written and documented in the heading materials and methods or methodology of your synopsis. Yes. And to follow this, whatever you have written, to achieve this, you should have something known as a Gantt chart. Okay. Now, what is Gantt chart? It is used to represent the duration, timeline, sequence of activities, and milestones of your research projects. Okay. So you have a time span of say around 2 years. So it will start once you get a scientific committee clearance, then the ethical clearance, then it will go to the university to see by the review board. Review board there will be external members coming, and they may also call back on you and your guide to come and check, to make some corrections in your synopsis. So once everything is done, which will take around 2 to 3 months, you will get a clearance certificate. Okay, and once, ideally your work should start after you receive this ethical clearance. Okay, but since you are in a medical college and you are working, you may start, you know, collecting data at least, and then so you have to decide, depending on your research question, how much time span is required for your data collection. You know, some people are going to use the data which is already available, so they can time themselves ki they can finish their data collection in first 1 year of your post graduation, and then, you know, next 6 months you are going to analyze the data, you find out your results, tabulate your results, write your discussion, and be ready for presentation. All your synopsis, I mean your thesis, should be presented in some national or international conferences. So these conferences will ask you to send the abstract before it will get selected for paper presentation. So for that, you have to be ready with the abstract. And when will your abstract be ready? When you are done with everything. Okay, so in other words, if you have a conference coming, say in the month of September, your abstract will be asked at the time of registration in the month of May. So you should be ready by that time with the complete data analysis ready. Okay, and you have to prepare the abstract and send it for presentation. If it gets selected, you have to do your oral presentation. Simultaneously, you should finish writing your paper along with your thesis and send it for publication, because as you all are aware, there are 3 publications which are must for all the residents. So one will be your thesis, and it should be done at the end of second year, and it should get over by your 5th post, because 6th post you will be busy with your final MD exams and all those things. So these are the timelines or guidelines which you are going to follow. So each individual student can make their own Gantt chart along with their respective guide, ki when you are going to finish what, okay, depending on your research question. So ideally what I believe is at the end of 1 year, you should have finished writing your, this is, I'm talking about your thesis, not synopsis. Synopsis, your timeline is hardly 30th June you have to submit. So before that you have to present in your department. So it should be ready by 15th of June, rather first week of June. Okay. So, but for your thesis, you should finish your review of literature and your introduction part, aims and objective, by first year. Second year, all data collection, data analysis. Second, at the end of second year, your thesis should be complete. Okay, so you can divide 2 months, 3 months, 4 months, what you are going to do and all. Okay, so that is about your Gantt chart, which is mainly for your thesis and not for your synopsis. So so that is all about methodology, what all things you are supposed to write. And one more thing I forgot to mention, you have to give references if you are going to follow if you are mentioning the methodology, you have to continue giving your reference in the procedure next to your introduction. Introduction means you must have given few references. So the next reference you are giving, that number you have to give in your methodology. So you can give reference in your methodology also. So that is all. So any questions, any queries?